And I thought, when I think about childhood depression, I kind of think about gray skies. Depression, like any emotion, kind of comes and goes, kind of like the weather. And so when we talk about childhood depression, one of the things that we're going to focus on is the fact that as a condition, sometimes we pass through depression, and then we may peak and go into other emotions and then come back into depression. We're going to talk a little bit about what is depression. Well, depression is actually a mood disorder that's characterized by feelings of sadness, hopelessness, loss of interest, engaging in normal activities. Actually, the American Psychological Association's clinical definition of depression, which is what we would term like a major depressive disorder, they define it as a common serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression causes feelings of sadness or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. And when we talk about childhood depression, also decreases a child's ability to function in their work environment, which is school. There are some facts I kind of wanted to go over when we think about depression and the occurrences of depression. Depression is the leading cause of disability worldwide. So more people struggle with debilitating depression to the level of a disability than any other mental health disorder. About 7% of adults in the United States have had at least one major depressive disorder episode in their life. And so 3.2 million adolescents in the United States have had at least one major depressive episode. The worst symptom of depression would be characterized as what we call suicidal thinking or suicidal ideation. Anxiety and depression are two disorders that are closely related. Nearly 50% of people diagnosed with depression would also fit the criteria for an anxiety disorder. I often think of depression and anxiety as a little old married couple. Where there's one, there typically is the other, but one is just louder. And so oftentimes people who experience anxiety due to the fact that they're overcome with worry also and cannot engage in the activities in the same way they used to also struggle with depression. And typically people who are depressed also have some anxiety at certain points in their life. Depression comes in a lot of different forms. There are disorders like persistent depressive disorder, where individuals have experienced depression over long periods of time, and almost may have what we call a flat affect. They are almost the depression, it's almost like a gray cloud is over them all the time. There's postpartum depression, so depression that's related to certain medical events like and hormonal shifts, like when individuals give birth, their hormones slip and shift, and afterwards there is postpartum depression. There's psychotic depression, and those are episodes of depression that have psychotic elements where people might hallucinate or struggle with knowing what is real and what's not real. And then there's what we call seasonal affective disorder, or commonly the acronym is SAD. And those are individuals that struggle with depression at the seasonal types of the year where they get less sunshine. And so it's almost due to the shortening of the day and less exposure to vitamin D. And then there's what we call major depression, or a major depressive disorder. It's usually characterized by an event occurring in somebody's life, as some triggering event. Less than 50% of people suffering from depression worldwide are receiving treatment. And so even though it is one of the leading causes of disability, a lot of people don't seek out treatment for depression. Adults, it affects your physical body. Adults suffering from a major depressive disorder are 64 times more likely to be affected by coronary artery disease. So depression also affects how our body functions. It's not just a mental disorder, it affects our physical body. That being said, only about 38% of adults over age 65 believe that depression is a health problem. And that just goes to show how depression has trended across generations. Early generations, people that grew up in the Depression in World War II looked at depression as a barrier to things, something that they should endure and try to overcome. They never looked at it as a health problem. And as people age, older people tend to believe that depression is just a normal part of the aging process. The exciting thing that I think is that 80% of people with depression can successfully be treated with medication, psychotherapy, or a combination between the two. And we'll talk a little bit about some medications and that combination. Rates of depression have been rising among adolescents in the United States. And more than 1 in 20 children aged 6 to 17 in some recent surveys were found to have current anxiety or depression by parent report. So, and according to the National Survey on Drug Use and Health in 2017, which statistics are always behind, about 3.2 million adolescents ages 12 to 17 years had at least one major depressive disorder. And about 60% of those adolescents did not receive any treatment for that disorder. So when we talk about statistics for depression, we need to know that it's very prevalent, that treatment is available and is out there. It's just trying to connect and link people into those services and kind of identify when they need those services. And we'll kind of touch on base on that today. Depression in childhood. Depression for a very long time was only thought of as an adult disorder. Oftentimes as different psychotherapies were developed over the past 100 years or so. Childhood was not thought of a time where a child could be depressed. Childhood was seen as a happy time, an easy time for children where they're playing. And so depression was only characterized as an adult disorder. It was only in the 1970s that there was actually a lot of research into whether or not children could be depressed and whether that depression was the level that it actually could be diagnosable. Could a child be diagnosed with a major depressive disorder? And so a lot of studies in the 70s proved that yes, children can get depressed just like adults, and that depression could be significant enough to actually be diagnosable. In early childhood, depression is equally common among boys and girls. So when we're talking about childhood depression, both girls and boys report depressive symptoms about the same rate. However, as we enter adolescence, girls tend to be twice as likely to report. It tends to be twice as prevalent in girls as is in boys. And that makes sense to me. Most adolescent boys don't like to talk about how they're feeling, kind of what's going on with them. And one of the ways that we diagnose depression is by people talking about how emotionally where they are. And oftentimes that's not something that adolescent boys like to engage in. So it would make sense to me, it would be skewed a little bit toward adolescent girls. So some red flags of childhood depression. How do you know that a child might be struggling with depression? One of the first symptoms is irritability. Oftentimes in children struggling with depression, you don't see those feelings of sadness necessarily that go along with the adult depression. What you will see is children that really struggle with irritability, anger management issues, and tantruming. You kind of see, they just struggle to kind of cope and deal. And out of that, you see lots of anger or lots of lashing out, that irritability. There are also behavioral changes to look out for. And those behavioral changes are all across the board. It could be that normally they really like going to Girl Scouts and Boy Scouts and being social, and now that's not something that they want to do. Normally they like going out and playing basketball after school, but now that's something you see that they don't do those kinds of things. Kids that are more extroverted suddenly don't want to socially interact, or kids that are, you want to see that change in behavior. Lack of motivation or interest in one's preferred activities. So things that children love to do or kids love to do, like I really enjoyed, going to soccer. Soccer was, I was very motivated to play soccer, and now I don't want to go to soccer anymore. I don't even want to talk about soccer anymore. I don't want to get up and go to soccer practice. I'm not excited about soccer games. That's just kind of gone away when that was a very intense interest of mine. And typically those changes will be relatively quickly. Like one day everything's okay to go, and now suddenly it's just not something I want to do. There could be behavioral problems. So sometimes because of that irritability and those behavioral changes, there might be behavioral problems at home. There might be behavioral problems at school. And so you have a kid that normally is very level-headed and calm at school. Suddenly, you're being called to the office. There's some behavioral problems, some issues that you haven't had before. Somatic symptoms, lots of aches and pains, physical aches and pains may come along with childhood depression. Most often kids don't tell you, I'm really sad. They may say things like, I'm really tired. I don't want to get up in the morning. My head hurts really bad when I think about that. That makes my stomach hurt. So there'll be a somatic or a body symptom that goes along with that depression. Sometimes there are feelings of guilt and shame. And so along with that depression, there may be, they may not want to participate in a certain activity because they don't feel like they're very good at it, or they may feel like they're the bad kid. They may talk about themselves in negative ways, and have feelings of guilt and shame. You might see academic issues. So kids that normally stayed on top of their work and academically excelled now are really struggling. They're struggling to turn work in. They're struggling to complete work in a correct manner. So there's academic problems. Another red flag of childhood depression would be social withdrawal and isolation. And so this is a hard one because sometimes kids are normally kind of loners. And so, if that's a normal behavior for your child, then we're not looking at behavioral change. But if you have a social butterfly in your home that typically is very involved socially with friends and with the family, and suddenly you see them wanting to spend more and more time in their room and they're self-isolating themselves, that could be a red flag to depression. Low self-esteem. Oftentimes kids struggling with depression don't feel like that they do a lot of things very well. They don't feel very competent in a lot of areas. And so they may talk negatively about themselves and their abilities. Oftentimes you might see fatigue, kids that sleep a lot of the time. Normally they were up moving around and now they just want to lay in bed and they want to sleep. And when you talk to them, they talk about feeling very tired a lot of the time, but fatigue is a definite sign of depression. It could be helplessness. You may have a child that's able to do a lot of things for themselves, but suddenly you see them because they're not feeling as competent about things, that they, look at you and they, I just can't do that. I can't seem to clean my room. I can't seem to clean out my backpack. There's this helplessness about the situation. There could be some attitudinal changes. Now, this is a hard one in adolescence to kind of figure out. But for instance, it may be that normally they're very respectful. Normally, they're very compliant, and suddenly they're not as compliant. Or maybe they're struggling. Normally they struggle with compliance, and suddenly they are being compliant, picking up their room, doing what they're supposed to. So those attitude changes are important to look for. They could have difficulty concentrating or making decisions. When we talk about depression, we're actually talking about issues with our limbic system, our emotional control center of our brain. And when our limbic system is overactive or are struggling with activity, what happens is that oftentimes parts of our brain are segmented off. Like we can't access our frontal cortex as well, where we make all our decisions. And so sometimes childhood depression looks like ADHD. You have a child that's very fidgety, has difficulty concentrating or making any kind of decisions. This is a difficult one to talk about, but self-harm is a definite red flag of childhood depression. And when I talk about self-harm, I'm talking about children or adolescents who engage in some sort of behavior, such as cutting, could be scratching themselves, picking at themselves, could be bruising or of themselves, like they punch themselves, or they may bang their head when they're upset, or they may punch a lot of things. So they're inflicting some sort of physical self-harm to themselves, which is a red flag of childhood depression. Now, not all self-harm, we'll talk about in a little bit, necessarily means that the child is, even if you have a child that's participating in cutting, it may not necessarily lead to suicidal thoughts, but it's definitely a red flag that that child is struggling with emotional regulation and depression. And then finally, thoughts of death or suicide. Oftentimes in people or and children who are struggling with depression, there's this sense of being overwhelmed, of being not feeling competent, not feeling able that they can achieve and relate. And oftentimes, if we've walked down that path, it leads us to a place where we think to ourselves, if, why am I in this world? Why am I here? So those thoughts of death or suicide often accompany depression. So any one of those things could be a red flag that a child is struggling with depression. I typically say when I work with parents, especially in crisis intervention situations, that parents typically have a really good pulse or feel of a pulse of a child. They begin to understand, I'm seeing things that are just not like them. And so when you get that feel, it's a good idea to sit down and kind of think to yourself, what is causing that? And childhood depression could be one of those things that is underlying those changes in behavior and attitude that you're seeing. There are some risk factors for childhood depression. Childhood depression tends to be more prevalent in children who come from chaotic or stressful home environments. And so, family environments where there might be domestic violence, or there might be a parent with a substance abuse issue, or, those kids are more likely to struggle with depression. Any kind of major life change, I will say in the pandemic situation, a lot of kids struggle with depression because of the change of what school looks like. That's a major life change. It could be, I'm getting ready to graduate from high school. That's a major life change. So any moment there are major life changes, the risk of depression increases. Children that have been in trauma situations, car accidents, natural disasters, any kind of trauma, or even home and family trauma, tend to be at greater risk to develop depression. Or kids that are under increased amounts of stress. So stress is a trigger for depression. And so if I see this sometimes in kids that are overscheduled. They are doing so many different activities. And they're in so many different things. The stress of trying to perform at a level across multiple things might lead to depression. Certain physical illnesses or medications can cause depression. Sometimes kids struggle with depression not because of a chaotic, stressful home environment or major life change. It's just they were placed on a certain type of medication. And that medication doesn't have to be psychotropic in nature. It could be a medication for a different type of medical condition. But always look through, if you look through possible side effects of many medications that children's on, depression is listed. So can be a cause of depression. And then just certain physical illnesses can cause depression. When we don't feel our best and we're not at our best, oftentimes that opens the door for us to struggle with depression. Other issues or risk factors for depression could be social problems with peers. I get on a soapbox here. Social media and negative inputs from social media oftentimes are big triggers for childhood depression. And so, because kids will do a lot of things in a virtual or viral world they would never do face to face. So there sometimes when kids are struggling with that social media component, or they don't feel like they're very competent on social media, I'm not getting the 1,000 likes for what I posted and things like that, or people have said something negative about my TikTok, can cause issues and open the door for depression. Failure of any kind. When we're striving to achieve something and we don't hit our mark, we fail, it tends to bring us down, and it tends to open the door for us to feel like we're not as competent, to feel like to take things in a more negative light. So failure, whether that's academic failure, it's sports organized failure. My team didn't win the championship I thought we were going to win, could open the door for depression. A history of depression in the family system. There is a strong genetic link for depression in family systems. And so if someone in the family system has struggled with major depressive disorders or some other type of depression, then it puts a child in that family system at greater risk to also struggle with depression. And then any kind of biochemical imbalances. And so And that can be genetic as well. We know that depression occurs when there's an imbalance in serotonin, dopamine, and oxytocin oftentimes in our brain. And so those biochemical imbalances can lead a child to struggle with depression. So what are the treatments? So we kind of talked about these are potential risk factors and red flags. So what is available? What's out there? And so three of probably the most effective treatments for depression would be antidepressant medications, and we'll talk about those in just a second. Engaging in some sort of psychotherapy, such as cognitive behavioral therapy. You'll hear it often referred to as CBT. And then there are some brain stimulation therapies, like electroconvulsive therapies. Typically, those are not provided to children. Sometimes adolescents that really struggle with depression, a physician or a psychiatrist might explore those areas. But commonly, the two most common treatments for depression for kids are antidepressant medications and cognitive behavioral therapies. Antidepressant medications, I would say as a parent, I would really want to do my research, and I would really want to have a conversation with my physician. Or my pediatrician, or if I'm my child seeing a psychiatrist, to really have that conversation. I think that there is some benefit in certain children, especially children that have been depressed for long periods of time, to explore medications to kind of help stabilize the situation, so you can employ some sort of cognitive behavioral therapy. But most antidepressant medications have been tested on adults. There's not a lot of tests that have been done on children. And so oftentimes side effects and dosing of antidepressant medications is very difficult. And so that's something that I would really want to have a conversation with a medical professional on, and really explore that going forward. I'm not anti-medication. I just believe that a lot of research needs to be done there. As for psychotherapy, cognitive behavioral therapy, talk therapy is what we call it, tends to be the most effective. However, talk therapy is not appropriate for kids that are under the age of like 7, because they just don't have the verbal skills. So other therapies for younger kids might be parent-child interaction therapy, might be a filial type of therapy, might be play therapy. But in that therapeutic environment, what we're going to try to do is try to teach coping skills and emotional regulation skills for the child to be able first to identify when their depression is triggered, and then know how to kind of verbalize how they're feeling. And then to work, and then to be able to start building that toolbox about, okay, now I know I'm depressed. This has happened to me. Who am I incorporating to help me with this? And what tools am I going to use to help me kind of process my emotions? So those are the two major treatments for children. And so if you have a child struggling with depression, if they're over the age of 7, you might seek out cognitive behavioral therapy. Art therapy works in some children as well, but cognitive behavioral therapy research-wise tends to be the best. So outside of therapies, what can you do to help and support your child that's struggling with depression? Well, first, you want to work really hard to create an emotionally and physically safe home environment. Depression is a very heavy emotion to discuss. And so you want to make sure that your child feels emotionally safe to share information. And then you also, due to the fact that sometimes self-harm or thoughts of suicide also go along with depression, you want to make sure that your home is physically safe as well. You want to educate yourself and your child about depression. There's a ton of research on the internet about depression and childhood depression. And so you really want to educate yourself about depression and correlate it to how that relates to your child. Because of all the information on the internet, there may be just a few symptoms that your child is struggling with. So how does that work? And also educate your child about depression. I think it's really important that we start with kids and we build a mental health vocabulary. We don't wait till we're adults to talk about it. And there are a lot of children's books out there that talk about depression and talk about how we deal when we're experiencing negative feelings that you could utilize even in your bedtime stories when you're reading and talking to your child. And then also when you're educating yourself, those teachable moments, There are a lot of great book series out there where children had symptoms of depression. For instance, I'm thinking about Harry Potter, a very traumatized situation. And often Harry kind of talked about in the book about feeling down and using those teachable moments in literature that your child's already reading to have those discussions about depression. Find a way to spend quality time with your child and create an atmosphere that's conducive for conversation. Prime the pump to talk. So, find that quality moment that you can spend with them. And then, make sure it's just kind of you and them. Make sure it's a comfortable atmosphere to have a talk about how they're feeling emotionally. I encourage daily exercise. I can't say enough about exercise. And it doesn't have to be like going to the gym. It's just getting up and moving, getting out in nature. It helps because it increases all those great brain chemicals and tends to make us feel better. Consider changes in diet. Oftentimes, our diet can lead us to feeling fatigued and down and kind of open the door for depression. So changes to diet is a great way to kind of help your child begin to manage those depressive feelings. Breaking down overwhelming activities into manageable pieces. So oftentimes we may become depressed because we can't make decisions. We can't see our way forward. So any activities that seem to be triggering depression in your child, break them down. We have to do this book report. We're going to do this on Monday. We're going to do this on Tuesday. And so just by achieving those, or, checking those things off your list, you're helping them see that they're making them feel more confident. They're making them feel more resilient. Help with time management by creating schedules. So anytime you can schedule things, because oftentimes in depression, things are just, we're overwhelmed. So you may have to sit down and create a schedule with your child. I think it's also important, anytime your child is struggling with depression, since school is kind of a child's job, have that talk with the child's teacher or the counselor at school or the principal, just to see, what can the school do? Is there some sort of modification they might make that might be appropriate in the situation, that could help your child kind of get over the hump and kind of begin getting a little more healthy outlook on themselves and their abilities. Create an environment that fosters healthy sleep. Create a sleep environment. When we're not sleeping well, we tend to struggle with our emotions. And so, making sure that our bedroom's a certain temperature or that we're not doing screen time right before we go to bed, all those things that foster healthy sleep will help in the management of any negative emotion, but especially depression. This one's a very, I clicked too fast, but acknowledge their feelings without judgment. And so this is really hard sometimes, because sometimes kids will come to us and say, I'm really upset. I'm feeling really down and depressed because someone on, I don't know, TikTok said my nose looked like Pinocchio's. And to us, we'd be like, what? Like, really? But to them, that is a really significant event. People are talking about me. And so, don't judge, but be open to listening to that conversation and just validating that, I'm sure you are very distressed because of that. Be open and model how to talk about distressing, difficult emotions. Modeling is the number one way to do, explore how you can incorporate that in your child's schedule. It's also helpful to, when your child's depressed, to identify those people in their life they can turn to for some support. So who at school could they talk to if it was a really bad day for them? Who at church is somebody that they might be able to share with? Who in the family are they comfortable talking about? And so helping your child identify those people they can turn to for support will help them. Here, I'm really overwhelmed by feelings of depression, and I already know that this is somebody I can turn to trust. If I'm really overwhelmed with depression and I have to figure that out on my own, then I may not be able to do that. And so just, having those plans in place, those support plans in place are important. Assist with the setting appropriate and realistic goals. Sometimes we become depressed because the goals we set for ourselves are just too high. Helping a child set appropriate and realistic goals. Maybe I'm not always going to make 100 on my spelling test, but you know what, what's realistic? Everybody has a bad day. As long as, I make, as long as I show that I'm learning my spelling skills, as long as, my grades are appropriate, I don't have to necessarily make 100 on every spelling test. Help your child stay connected and involved. Depression, we want to isolate, we want to withdraw. So any connections with friends, any activities that you can do, sleepover, stays, anything that you can do to help your child stay involved will help them deal with that, their depression. Increase supervision and stay alert. Because of the nature of depression, sometimes as waves of depression come over kids, it can get really significant, really in a scary place relatively quickly for them. And so just, if your kid's struggling with depression, make sure that, you have eyes on a lot of the time and that you're kind of alert to those changes that might happen. And then finally, it's really important to seek out help from a mental health professional or your child's physician. Children that struggle with depression, one of the important things is the sooner we seek out mental health care, the sooner or the smaller the issue is to work on, and the sooner the child can have relief. I mean, it's like a toothache. If I wait, if my tooth is sensitive and I go to the dentist and they work on it, they might just have to do a few things and I feel a lot better. If I wait until my tooth is throbbing and my head hurts and my jaw is all swollen, then the interventions they're going to have to do are going to be a lot more intense, and it's going to take a lot longer for me to feel better. So I thought I'd pause right there for just a second, because the next subject we're going to talk about is we're going to talk a little bit about suicidal ideation in children. And this is a very, very heavy subject, and it can be highly triggering for individuals. And so as a part of this series, I also have a handout that I will send along. If this is a triggering subject for you in any way, please feel free to access that information in a different format, like a written format. Because when we talk about suicidal ideation in children, it is a highly triggering and subject matter. So I just wanted to pause and let those people do what they needed to do before we go forward. So, all right, we shall forge ahead. So when we discuss suicidal ideation in childhood, oftentimes children may have thoughts of suicide and not the suicidal behaviors that follow them. So I'm thinking about hurting myself, but I haven't actually done a behavior to hurt myself. Sometimes kids will have thoughts of suicide and actually have engaged in suicide attempts or suicidal behaviors. Importantly, however, is suicide in early childhood is relatively rare in children under the age of 12. It does occur, but it is not. It does not occur at the same rate as children and adolescents. And so oftentimes in young children, they may have suicidal thoughts. They may have thoughts of hurting themselves, but it does not have that corresponding behavior with it. Suicide is the second leading cause of death in Oklahomans aged 10 to 24. So it is a significant mental health problem in our community and in our state. The majority of youth suicide deaths in Oklahoma are among males, but suicide death rates among females are increasing. So it's something that we see typically. And I look at that at kind of corresponding with what we talked about earlier. Girls, adolescent girls tend to be more open to talking about feelings, where adolescent males really struggle with that. And so I think that this statistic kind of corresponds with that. Girls sometimes have outlets and are willing to talk about kind of what's underneath, where adolescent males feel kind of isolated about talking about emotion. The use of firearms and hanging or strangulation are the leading methods of suicide for youth in Oklahoma. More than 50% of completed suicides by teenagers and youth in Oklahoma occur with firearms. And that's really important to think about, because if you're dealing with a child that struggles with suicidal ideation or has a pretty significant depression, then you as a parent want to take steps to ensure the safety of your child. So if you have firearms in your home, that they're locked away, that, that key is put away, that you are looking for ways to keep that child safe. So, you're making sure in the room that they're in, that there's no rope, anything like that. According to the CDC, there's no single reason individuals consider or attempt or complete suicide, because it's kind of a cafeteria of reasons. So it's not like this one thing caused that one event. It's more like there was a multitude of risk factors and warning signs. And sometimes those risk factors and warning signs are very obvious, but oftentimes, especially in adolescents who are contemplating hurting themselves, that could be a very hidden thing. We like to think when we hear things on the news, well, that was a real obvious situation. But oftentimes great care is taken by adolescents to kind of hide those feelings. They don't want to upset anyone in the family system. And so that's why when I talk about that monitoring of social media, sometimes they're more apt to share it among peers and friends. Which is also why in adolescence, I think it's really important that we begin teaching kids, if you hear something, say something. I think that's really important. And even in younger kids, if you know a kid that's really struggling, then find an adult and let them know. And even though that thoughts and thinking, suicidal thoughts can precede suicidal behaviors, most research out there on suicide indicates the completion of suicide is most often an impulsive act. So even though people may think about suicide or may plan it, the act itself is very impulsive. It's usually something that they decide to go forward with it in a short amount of time or short space. Actually, the window that a lot of suicide research will tell you, it's about a 3 to 5 minute window. And so, teaching your child when to ask for help or when to go get someone else and talk to them is really important, because it is such an impulsive act. And oftentimes with adolescents, they're already so impulsive anyway. Possible warning signs of suicidal ideation. Now, before I go through with these, I want to say that in some kids, it can vastly differ what it looks like. And so even though I go through this list, some kids may show these symptoms, some kids may not show these symptoms. They may be going on, but they don't actually show them. So, and it can be different from kid to kid. And even with siblings can display warning signs in different ways. So things to kind of look for is displays of negative emotions lasting longer than 2 weeks. So anytime a child is dealing with depression, or they're really negative and it's just gone on and on, it's a longer than a 2 week period, that could be a possible warning sign. That's an area to investigate. Fatigue, not a lack of motivation. They can't get up, they can't seem to engage, or they don't want to engage. Any kind of major changes in eating or sleeping. And that could be sleeping too much, sleeping too little. That could be overeating. That could be not eating at all, or really a restrictive diet could possibly be a warning sign of suicidal ideation. Any kind of preoccupation with death. So if you're looking at their online activity and you see lots of sites about death or dying, you might check that out. Giving away of personal possessions. And I think this is for any age group. Anytime anyone gives away something that's personal and special to them, and they have some of these other symptomology, we need to kind of explore, is that person struggling with thoughts of suicide? Academic performance problems. So kids that normally perform really well academically, suddenly everything tanks on them. And there's no real explanation for it. That might be a kid that's kind of struggling with some suicidal ideation. And then engaging in risky behaviors. And that could be everything from peer conflict at school to now I am jumping my bike off things that are really high. I mean, it could be any kind of engaging in risking behaviors that's normally not what we see from that child. So what should you do? If you are concerned that your child or a child in your life might be struggling with suicidal ideation, well, the very first place to start is to have a conversation with them. And this can be a very difficult conversation, because through the course of the conversation, you're going to need to ask them if they're experiencing some suicidal thoughts. Research will show you, or will tell us, that the best way to approach it sometimes is the most direct, especially with older kids, just by asking the question. And it's such a hard question to ask, even as a trained therapist, where I have worked with lots of individuals struggling with suicidal ideation. That question is still difficult, just by asking, have you been thinking about suicide? Sometimes people back away from that because they're worried, if I bring it up, will it cause them to start thinking about hurting themselves? No. What research shows is no. If you really think a child's struggling with suicidal ideation, sometimes the most relieving thing you can do for that person or that child is just to ask. Now, how you ask the question, though, kind of depends on what's most natural for you and what's most natural for your child. And we kind of have to think about developmental levels when we're talking to a child about thoughts of suicidal ideation or suicidal thoughts. And here are some ways that you might ask. And this list is not inclusive or extensive, but these are just other ways that I have asked, or other ways that some of the suicide trainings that I've gone to have suggested asking. You might ask, are you having any thoughts about harming yourself? Because any kind of self-harm is a red flag for possible suicidal ideation. Do you feel safe with yourself? And you might have to describe what safe means, but I think that sometimes kids that are struggling with suicidal ideation do not feel safe with themselves. Do you want to close your eyes and never wake up? I think that that's a great question to explore, what we call passive suicidal ideation. Those ideas that, things might just be better if I just wasn't here, I just didn't wake up. I do want to stop here and say, whether suicidal ideation is passive or active, there's more of a plan. They both are significant. It doesn't really, the only thing is, in active suicidal ideation, we'll talk in a little bit, you need to respond immediately with some outside support. But both, a child saying, yes, I often hope I don't wake up in the morning, is as important a bit of information than a child that might have a viable plan. Are you so overwhelmed that you don't want to be in this world anymore? And that's one of those more passive things you might ask. Other ways you might ask, you might tell your child, I love you so much, and I'm worried about you. Are you thinking about dying? Do you feel hopeless right now? Kind of exploring that overwhelm, that sense of helplessness or hopelessness. Have you ever thought about hurting yourself? Might be a way to open up and start that conversation about suicidal ideation. Now, if the child answers yes to any one of those questions, if yes, I have felt like hurting myself, yes, I sometimes feel like I don't want to wake up in the morning, or I hope I don't wake up in the morning, then it's extremely important for you to follow up by asking them if they have some sort of plan. For instance, I'm struggling with feelings. Yes, I sometimes think about hurting myself. Then to follow up and ask, well, when you think about that, do you think about what you might do? Now, as a parent, this is all I can tell you is remain as calm as you can in the situation. And also realize that by having this conversation and opening this door and giving your child the support, you are opening the door for the healing process. I mean, this is to be able to identify and talk about negative emotions is one of the most important steps that you can do to support your child dealing with suicidal ideation. So, but do follow up and ask if they have a plan. If they don't indicate they have a plan, but you think they might, or if they tell you they have a plan, they disclose a plan, even if the plan may seem silly to you, like I'm going to run my bicycle into a brick wall. It's still a plan. If they have a plan, you need to seek mental health support immediately. So what does that look like? Well, you have options. You could call, I provided with you the National Suicide Prevention Lifeline. It's open 24/7 and they would walk you through the process. You could take your child to a local emergency room for an assessment if you felt like that, it was a pretty significant, if you need to go that direction. But you do need to follow up with some sort of mental health support. You need to seek out maybe a crisis session, maybe immediately trying to get your child engaged in some sort of therapy. A lot of agencies, my agency does 24/7 on-call crisis. We do walk-in crisis services. And so finding someone immediately to offer you and your family and your child support is really important. Edmond's very blessed. We have police officers trained in mental health assessment techniques, especially in the area of suicidal ideation. And so if you're dealing with an adolescent that doesn't want to go with you and you're really concerned about them, you could call 911. Just tell them that you're dealing with an adolescent and you're concerned about their well-being and safety. You might think that they're struggling with suicidal ideation and that you need what we call a CIT officer. It's a crisis intervention trained officer who will come and help you determine whether or not, the ideation is significant enough. You need to do something immediately. So those are some options. But like the Suicide Prevention Lifeline is always available. It's always there for you to access, and they'll work you through that. So what are some do's and don'ts after the disclosure? Well, the first do is stay as calm as you can. It's really important for anyone that talks about suicidal ideation to not feel like they've upset another person. And it's really important that the kid doesn't feel like they're in trouble. Oftentimes, when I'm talking with a kid who has disclosed that they might be suicidal, I'll say, that must have been a really difficult thing to talk about. And I'm so glad that you agreed to talk to me about this. I think is because now that we know this is an issue, we can work together on it. Do be reassuring and let them know that the feeling, I know that you're feeling really bad right now, but we're going to work together so it's not going to be this way forever. We're going to work on this together. Sometimes just asking them what you can do for them, like I know that you're really struggling with this. Is there anything that I can do to help? Is also helpful. Do remove any unsafe items. And if they can't be removed, then lock them away in a safe place. Especially if a child has some sort of plan and the objects are a part of that plan. Don't judge, be empathetic and understanding. Being a kid is tough. Being a human sometimes is tough. And many, many people struggle with depression and many, many people struggle with suicidal ideation. And so, whatever they're going through right now, they're just needing that support. And you started that process by opening up and starting the conversation. And most importantly, do not leave them alone. Supervision is really key to kids after they disclose any type of suicidal ideation. So make sure that it's all hands on, even if you have to tag team with family members, just don't leave them alone. Okay. Protective factors for suicidal ideation. So what protects a kid that might be struggling with thoughts of suicide and keeps them from actually those thoughts becoming suicidal behaviors? Well, personal resiliency and competency. When I feel like in any area of my life, like I can cope and deal and be competent, then I am protected. I might have those thoughts, but it protects me some from those behaviors. Any emotional regulation abilities, learning how to breathe correctly, learning ways of progressive relaxation, any emotional regulation, maybe physical emotional regulation. I go out and I play basketball, anything that I can do where I can regulate some of my emotions is going to help. Because if I can regulate some of my emotionality, then I feel like I can regulate my depression. Problem solving and coping skills are really important. The more problem solving and coping skills that we can teach our kids, the more we insulate them. Strong social supports from family and friends, that being connected, not being isolated. And then just positive experiences at school, at home, in the community. When we're really down on ourselves, any positive experiences that we have help insulate us, help protect us from long-term struggle with suicidal ideation. So what are long-term supports for kids struggling with suicidal ideation? First, find your child a therapist that they can connect with and trust. I can't say this enough. Therapist choice is one of the most good connection, and a good connection between therapist and client is one of the best indicators of success of therapy. And sometimes people do more research on buying a car than they do picking a therapist for their child. And so really do your research. I mean, talk to other parents. Look online. A lot of therapists are on Psychology Today. They'll have websites. Read up, look at what is that what is their therapeutic modality. Do they do a lot of breathing and a lot of yoga, a lot of body things that might be helpful to your child? Do they do art there? So find that connection, and you're going to have to do a little bit of research to find it. Model open and honest talk concerning negative emotions in the safe environment at home. So once again, just continuing to be open to have your child talk to them about, kind of what they're going through and the negative aspects of their emotion. You might consider creating a safety plan with your child, but it also has to be with a mental health care professional. I think it's part of working with kids that struggle with suicidal ideation or thoughts of suicide is creating a safety plan, which is basically just a plan of when I'm triggered and I have these thoughts, what do I do? Who do I go to? What do I say? What's going to happen? And so oftentimes when you begin work with a therapist and a child struggled with suicidal thoughts, they'll create a safety plan, and just creating that and following it in your home is really important. And then you also have to seek support and help for yourself. There was one of my favorite bits of therapeutic information I've ever heard came from a therapist who had a long tenure in our community that said that you cannot manage a tornado from inside the tornado. And so oftentimes kids that struggle with intense depression or suicidal ideation, their emotions, it's an emotional tornado for them. And so as you help them through that process, you're going to need someone to talk to. You're going to need someone to process with. And so, oftentimes while you're looking for a good therapist for your child, you might explore, what would therapeutic support look like for myself? Or maybe maybe you want to do some sort of couples or marriage counseling to kind of help the family system deal with a child that's struggling. That support could also be self-help groups. There could be where you could talk to other parents. It could be through your church. Just, maybe you have a prayer group that is very supportive to you. Maybe there are other parents that that have struggled with this that you could reach out to that could help. But that seeking support element is so important as you walk with your child through that process. So I've come to the end of my time. I have my information up. I do have my email address up. Please email me if you have any questions. Once again, if you're looking for just where do I turn to, what might be a good referral, I want more information, please feel like you can reach out. There are a lot of supports within the community that will help you through this process. Find a way to connect.